Welcome back. Consuming large amounts of fast-digesting starches leads to higher levels of blood pressure, in addition to high levels of triglycerides, leading to weight gain, high cholesterol, and the risk of cardiovascular disease. However, eating starches such as bread, rice and even sweets are not harmful if a person is able to deal with them properly, but there are some times when you should avoid starches such as bread, rice and sweets as much as possible. You should know that bread, rice and fruits, even if they contain healthy nutrients, but these nutrients are not essential nutrients for the human body. This means that the body is able to live and is able to perform vital processes to the fullest without the need for starches such as bread, rice and sweets. We can get the nutrients, vitamins and minerals that the body needs without eating starches such as bread and rice by eating basic nutrients such as proteins, fats and vegetables. It is very possible to eat these starches without any problems as long as the person is very active and does not suffer from metabolic problems such as insulin resistance. He will benefit from these starches by using them as energy for the body to increase sports performance, help build muscle mass, and continue to do strenuous exercises without feeling tired such as walking and swimming. However, there are times and cases in which it is preferable to avoid and exclude starches in your diet. In fact, there are 5 times when it is best to stay away from eating starches. Number 1. If you are inactive and have little movement. You should know that when a person consumes starches such as bread and rice, these calories will eventually be converted into energy within the body. If a person does not use this energy when increasing activity or when performing exercise, these calories coming from starches will be converted into fat stored inside the body. A higher percentage of fat in the body leads to higher levels of bad cholesterol, which can be considered a vital sign of a higher risk of cardiovascular disease. If you have few steps, less than 5,000 steps a day, and you do not practice any exercise such as resistance exercises or cardio, it is best to reduce the amount of carbohydrates you consume. Number 2. If you suffer from a metabolic problem and are unable to deal with sugars such as insulin resistance. Insulin resistance indicates that a person consumes carbohydrates in a high amount. High blood sugar levels and a chronic rise in insulin over a long period of time indicate pressure and burden on the pancreas when it releases insulin. Then, the amount of starches you consume should be reduced in order to recover from insulin sensitivity and body cells are able to respond to insulin call better. If the result of blood sugar or fasting sugar is more than 120, cumulative sugar is more than 5.7, or insulin resistance analysis is more than 1.5, this indicates that you need to reduce your consumption of starches. However, if you are using blood sugar lowering drugs, you should consult a specialist doctor before resorting to reducing the amount of starches you eat. Number 3. With age. After the age of 40, the number and efficiency of mitochondria responsible for producing energy for the cell decreases. This varies from one person to another. If a person is keen to increase activity, he will maintain as much as possible the number and efficiency of mitochondria, which is the house of energy. As we increase the number and efficiency of mitochondria, the better we deal with nutrients. With age, the number and efficiency of mitochondria decreases and the body's ability to deal with nutrients, especially starches, so it is preferable to reduce starches and the amount of starches is appropriate for your daily activity. Number 4. If your body is unable to accept some types of starches, it is important to know if there are some annoying symptoms in the digestive system such as gas, constipation and chronic diarrhea. These symptoms will hinder the ability to lose fat. In order to get rid of these symptoms, some starches may not be suitable for some people, such as starches that contain gluten, which is wheat protein found in wheat and bread. Milk may also be annoying to some and hinder the elimination of fat, as well as fruits from fermented foods in the digestive system and cause annoying symptoms that prevent getting rid of fat. For example, if you are unable to tolerate gluten and wheat products, It is best to stop them and use bread substitutes made from seeds and black wheat. Regular milk can also be replaced with almond milk, coconut milk and oat milk. Fruits can also be replaced with vegetables. You will get the vitamins and minerals you need from vegetables only. There is no need to eat fruits to get nutrients and minerals. If you are keen to eat fruits, you should eat low-sugar fruits that contain a small amount of fructose sugar such as lemon, avocado, berries and strawberries. Number 5. Stop eating starches or reduce their consumption in high-fat meals. If you eat a meal that is high in fat and also high in carbohydrates, this causes metabolic burden. When eating a meal rich in saturated fats such as red meat or organ meats such as liver and hearts, you should avoid eating starches, especially fast-absorbing ones such as bread and rice. One of the diets that advise you to reduce the amount of starches that are suitable for the times we mentioned in this video is 1. The low-carb system allows you to eat 50 to 100 grams of carbohydrates per day by eating healthy starches such as vegetables, fruits and legumes such as beans. 2. The keto diet allows you to eat less than 50 grams of starches coming from seeds, nuts and low-sugar fruits. 3. The paleo diet system allows you to eat low-sugar fruits along with proteins and fats. Choose the right diet for you. We welcome and thank all new subscribers to the channel and fans of this video.
Thank you for watching. Subscribe to like channel to receive all new news.